tooth. So I'm going to start with that one. So there's a pretty good sized class 3 composite in there where I just took out. And it looks like it's a little soft underneath there. So I'll probably build that back up. Cool. Is my mic back on, guys? Today I am. If I'm doing a no prep case, like I'll show you. I'm not gonna really put a margin on the bicuspids here. I'll show you how I'll do that. But on these, I think it's appropriate to make a margin. There's a little white spot here, which I kind of expected. So I'm going to prep that back until it's gone. So when you're not breaking contacts, you want to push the margins lingual to like the contact. And so turn your head this way. And so you can see like right in here, like I'm like right at the contact, and I'm happy leaving it right about there. And I'll go back and refine it with something a little bit smoother than this. Kind of the same right there. I took it right about to the contact. You don't want it in front of the contact, especially on the mesial. If it's in the front of the contact on the mesial, you're going to show everybody. And so you want it just barely to the contact. So you don't need to break it. Good. And then I'm just going to round these. So this is my two-handed prep technique. You can see I use a lot of support just so I can be smooth. James be chilling like this, prepping like this in the mouth. I'm not doing it like that. Okay. So let me show you how I'm going to do this bicuspid here, because I'm not going to really prep this bicuspid much. Let's use. Do we not have a red? So this. Oh, here it is. Okay, so I've got this little red guy here. So I'm going to like near no prep this tooth, and so I'm not going to put a margin on it. It kind of already has a margin from the abfraction. So I'm just going to round this a little bit right there. And just take off all the high spots. And then zip the edge a little bit. Okay, let's rinse that. No, I'll fill that in with cement, but I want to blend it a little bit. It's not that deep. Cool. All right, side. Most of the prepping is done there. And then for
when you have the fractions, are you telling the lab not to add porcelain there?
Well, so we'll talk about that a little bit maybe tomorrow too. So that fraction can be tricky. I don't have to do anything else to that tooth right there. So abfractions can be tricky. They can get you into a lot of trouble. Turn your head to the right now. Reduce this back. This one's like not long enough for this tooth. What do you mean? Yeah. So I'm just making sure, and I'll go back and refine it with that little red one I had in a minute. I'm just trying to give me something there. I'm just taking it right at the gum line, very, very slowly. There. So you can see there's just a little teeny margin all the way around. And that'll be a little bit more refined when I take a little red burr to it. And then I want to take that just a little deeper. I'm like right at the contact. Yeah, I'm not really pushing through it, but I'm just tapping the contact. Yeah. Okay, let's push them out. Ryan, you holding up okay? All right, good. All right. Now, do the same thing. I'm so bad with losing things. There it is. Okay, so now I'm just going to go in with this little red guy and refine everything, and then I will check my prep guide. All right, so do you guys think it's important to deliver really smooth preps to the lab, or do they care? What's that? It's important, you think it is? I've heard both ways, honestly. But my son, who's the designer who's going to see my preps, I have to make them smooth because I'm too prideful because I know he's going to look at these and judge me according to everybody else's. I will say that I've seen probably 100 different dentist preps, and so I can tell you who does the nicest preps and who does really terrible preps. But you'll probably get the same result. However, it is easier for the lab to read a smooth prep. Way easier for a lab to read a smooth prep. Now, it doesn't have to be glass. You don't need to take like these polishers and polish them, but at least take a red diamond to it and make them a little cleaner. Have some pride in your work. So I'm like putting no pressure on this. Good, turn this way. I have, yes. Yeah, I've touched the incisals of most of these. Are you feeling that? Okay. Okay. I'm going to go in now and check my reduction guide. And so I'm going to try this in real quick. And it should sit right like that. And let's look. So backwards in this. So you can see at least half. I think I've got it everywhere there. Let's look around this side. Oh, I think we're pretty good all the way around there. Now that I'm looking at it in the mirror here, I'm going to reduce just a little bit on 9 Everything else looks pretty good. Yeah, just the mesial 9, just a hair. It's probably fine, but that's an area that they told me I would need to reduce. So I definitely don't want to leave that shy. And his preppy's kind of yellow, and so we might want to go with a lighter. I might go with the BL shade temp material just to get him to like an OM3, OM1 is what I'm thinking we'll finish him in. He also has these places where he had ortho. He had a little picture retainer, so I'm going to zip that off right now. So let's do that real quick. He's going to like that. Always make sure you have good posture. I have ergo loops. I'm not as fast with them yet. I've only had them for like 6 months. I can't deliver with them. I know. Oh, I wear them all the time except for when I deliver. And I'm still not as fast, so I brought these for the class.
They're weird though.
No, they are weird, but I think they're great. Do you have like a slow speed round burr? Like I want a slow speed round burr because I just want to clean this out a little bit. There's some decay in there still. All right, let's look at, go ahead. Let's look at this. So here's our incisal reduction guide. Can you guys see that? Lift your chin up just a little bit. Nope, down. Sorry, the other up. So I think we've got good reduction there everywhere. It's focusing here. Let's let it focus on the teeth. I want 0.5 millimeter. This has got well over that, so I'm totally good. This might just be a little bulky here now that I'm looking at this too. Thanks. So now we're gonna do some general dentistry real quick. I know nobody came for this, but we're gonna do it.
How are you ending the lingual? Is it just like a butt joint?
Yes, it's always just a butt joint. Good, this one harder than I thought it would be. You have some composite I can fill this with. Yeah, flow's fine. I'd prefer packable. This one's kind of big.
So this is just gonna be part of your prep, or are you gonna fill it all?
I'm gonna fill this. I'm gonna fill it, just part of it. I'll show you, yeah, and enough so that because if I were gonna make this part of the prep now, I might as well just do a crown at this point. But I've got all the solid enamel right here in the face. I've got all the solid enamel right here on the cingulum. I'm confident enough. I mean, I saw his gums when he came in today, and they look fantastic. This is something from a long time ago, so I'm not super worried about it coming back. And I'll always, whenever I do this, I'm telling the patient, look, there's a possibility you might need a root canal on this tooth. And that way, if it happens, it's not a big deal. Explorer hiding somewhere. Is this an Explorer? No, that's not an Explorer. There we go. There. That feels good. What's that?
I said his TV is off. I don't know what he says.
Oh, his TV's off. He's asleep. Are you asleep, Ryan?
Yeah.
Yeah, he's basically asleep. He's having a great time here. It was until I woke him up, right? All right, let's do a little hydrogen peroxide real quick, and then etch and bond and. What's that? CVS. No. We'll use superoxide tomorrow. Not today. Give me a little bit more. Okay. Etch. Turn your head to the left a little bit. Brian's a freaking great patient. All of you guys should want patients like him. Like, I'm not joking. Did everybody have a chance to meet my granddaughter?
No.
Oh, you should go. You should go meet her. She just turned. Well, she's 18 months next week. She's so fun now. She'll agree with anything you say. She'll be just like, yeah. It's so fun. I know. Not with me. Oh, we're gonna get matching outfits. We're going out for ice cream. She lives right next to Ryan. I'm really super jealous. They live up in the same area, and I don't get to see her as often as I would like. But when she comes down, if I have to buy a pink convertible, I'm buying a pink convertible. I mean, whatever she wants.
You're gonna be Elsa.
I'll be Elsa. I don't care. I'll be Elsa. Maybe she will. No, if she's anything like her mom, she'll be a dancer. And that's just fine with me. She already loves to dance, so.
And you prefer composite over like a bolt fill or like a flow bolt?
I do, just because I have more control over it. I mean, it's not wrong either way.
No.
Cool. That looks good enough for me. All right, let's rinse them out really good. What's next on my cheat sheet? After we prep, what's next on my cheat sheet?
Eva with the guides and then prep shade.
Prep shade. Better be taking prep shades. You have prep shade guide? So. All right, let's smooth this off now.
What do you need? This one?
All right, I'll let everybody come and look at my preps in just a second. And you can critique me, I don't care. Okay. So my last step of my preps, is there a black disc? Is I'll take a black disc. Yeah, it's the heaviest one. And I'm just smoothing everything. I just want to smooth everything as nice as I can, especially the incisal edges. And so I'm just kind of rounding corners here.
You want me to flip open your light or do you like orange?
Oh, thanks. This is actually a really good case to see because it's not easy, but it's not ridiculous hard.
Right.
I got a lot of pressure. I got to make it look easy. No, we always have said that at some point we're going to, at one of these classes, turn to the right. At some point in one of these classes, it's not going to go smooth. And that will be the best class that anybody ever came to because they're going to learn how to deal with the complications. Because it happens. It happens often enough. Like in a perfect world, I wouldn't have had to do anything with that tooth and it would have been fine, but you wouldn't have learned as much. No.
You said you are going to veneer it.
Yeah, I'm gonna veneer it. I'm not gonna do anything in preparation for it. So we'll talk about how to treat that tomorrow when we talk about delivering.
It's a PFM.
It's a PFM.
Did you ever have to remove some of the porcelain from the PFM?
I actually am on this one probably gonna have to remove a little bit. Yeah, maybe not. As I was looking at it on the model, I was like, I might have to remove a little bit of the Pontic, but I don't think I will now because the Pontic is actually slightly bulkier than everything else. All right, I'm just gonna double check 8 here. Give me a. I'm just making sure I have draw. So I've got to be able to deliver this either facially or incisally. And so I got to make sure I have draw, and I need to prep that down just a hair more here. It looks like I'm use my 2-hand technique. Be steady. Then I always go back and check the mesial gingival of the canines, or sorry, the laterals. Just make sure I'm deep enough. And I think I'm good. All right, everybody come and have a look if you want to. Critique it. Ryan will stay open. He's cool. So you can look at it. And then I'm going to show you next. Well, we'll take a prep shade next, and then I'm going to show you how I get my retraction.
Don't mind us.
No, no pressure at all.
I know.
36.
If you're a total dorky dentist and want to come see the preps, you're welcome to. I won't judge. You can judge me, but I won't judge you.
I like the rough disc after.
It just makes it look a little bit more. I mean, you can polish it as much as you want, but that's as much as I ever really do it. Have a look. Jump in there. If you're going to touch them, put a glove on. Hey, girl. Whoa. Okay, don't do that. Don't do that.
It depends on how you throw a camera.
I know.
Yeah, that's much better.
I like followed the ball. I read it.
All right, everybody in the room, get in the picture here.
See Ryan.
If you can't see, jump in. 1, 2, 3. Man, that's a good looking group. We don't allow ugly people at these classes.
So the way that you prep 8 is you just made that mark and go all the way around.
But it doesn't wrap to the lingual. So there will be a little bit of composite on the lingual there. And so could I have made that a crown? Absolutely, I could have made it a crown. Would it be better as a crown? I don't know. Maybe not. I'll tell you in 10 years. Yeah, for right now, I would rather have that done to my tooth than to crown it. Yeah. And so it's just, yeah. Yeah, do what you think you should do on you. Like why get all hung up on anything else? It works most of the time. I mean, I saw a patient this week who, when I was delivering the case, super thin feldspathic, no prep case. When I was delivering the case, I tack cured number 10, and then I tack cured 9. But I was like, maybe I'll push it a little bit harder, and get the cement out. Cracked it right down the middle. Visceral response, and I was like, because she is probably the most famous person in Tucson, and then I went and I tack cured everything else because it's all in there. I wasn't going to stop at this point. I went back and looked at it, and it was a pretty fine crack, and it wasn't super noticeable. I just kind of pushed it together and cured it, knowing that she was going out of town the next day. I wasn't going to temporize that. And when I sat her, so thankfully, look, these are very thin. Something might happen when I would do this, and it wasn't a big deal. So I sat her up. She's looking up. She's like, "Oh, these are stunning. These are so pretty." And I said, "Chanel, I got to tell you, number 9 is cracked." She's like, "Where?" And I showed her, and she could see it when she was looking really close. I said, "I'm happy to replace that." She's like, "Why?" She's like, "It looks great." She's like, "Is something bad going to happen?" I said, "I don't know. I don't think so." Because it's literally right in the middle. And so there's a good amount of porcelain above and a good amount below. And so I saw her, it's been 2 years. It still looks brand new. And she's very happy with it. And she knows she has a lifetime warranty on that.
Yeah.
Like, I'll replace that at any time. So she sent her mom. Her husband's coming. Her husband is the most famous person in Tucson. He's coming to see me in a couple weeks. So she was very happy. And so just do what you think is right. Like it's all going to work out. As long as you're honest with patients, I think that's really the biggest deal. They want to know that you care about them, that you're going to do the best thing for them, and that you're always going to be there for them. Like that's all they care about. Even if let's say number 8 on him goes south and needs endo, I'm not going to take responsibility for it, but I'm going to hook him up with the best endodontist I can find, and he's going to get that taken care of. So just be the good person that you would want treating you. That's all. All right, anybody else want to look? Cool. All right, let's get back to work here. Prep shade, you got a prep guide. Okay. So this is how, actually, let me get a picture of the preps first. What's it say? Prep shade, all right, here we go. I can always tell when people have handled my camera because my focus point is always off. Cool. All right. So this is how, let's see, open. I'm going to go right there and just, that looks a little dark. Let's come over right here.
What are your settings on your camera to get a good shade selection?
Well, so if you want a really good shade match, then you will take a picture. So I've got it at 100, 100, where I always keep it. And I'm at F25 right now. So now I'm going to crank it up to F32. And so it gives it a little bit more dark of a look. So the labs like that. So let's go F32, boom. So you can see it's a little darker, so they can see the contrast a little bit differently there. Then we're going to go F20. And so they can get it when it's a little bit lighter. Do you have the ND shades?
Yes. That's what I was gonna ask.
Yeah. I usually use the NDs. Oh, there we go. So, but it doesn't hurt to get them all. And so, yeah, let's just do that whole complex right there. Good. And then let's pump that up. So just take it with a few different f-stops. Like they'll be able to tell what shade it is with all of these different f-stops. And so just give them more information than they need. And then one more. And this is the right way to do it, is hold it end to end, incisal edge, end to end like that. Make sure you're getting the numbers on there and snap the photo and then go up and then boom, right there. They'll definitely be able to tell what shade it is.
Where's that remote? Can you change the focus a little bit?
Okay. All right, so now I'm going to show you how I do my, I don't even know what this is called. I saw somebody else do it, and I wish I could remember who it was because it was gangster, and it works great. And so I will take Blue Moose now, and I'm just going to Blue Moose his teeth. And make sure I'm getting in to the margin area really good. And then I'll just kind of come over the edge. A little bit like that. And then I'm just going to leave that just for the 30 seconds that it takes, whatever. Then we have Traxident. Here's some. And then I'm going to take it off. Then I'm going to put Traxident around all the margins. Then I'm going to shove it back on for 5 minutes. And then we'll get a nice retraction. Then do we have a scanner ready to go?
Yes.
Okay.
So this is an instead of.
This is instead of cord. And you'll see that we'll get pretty good retraction out of it. Because what will happen was that when I put the Traxident in, it will push up against this, which fits perfectly in there. And so it'll actually push the gums out just a little bit. And it'll also turn them a little bit black. That's why James doesn't like it. James, again, he sees 22-year-old supermodels. I don't. All right, and so then I'll just take this. I might need more. Do you have more? And so this just kind of goes out around all the margins here. Man, I am not strong enough for this. Is it? Oh, yeah, this is a way better tip. And I always load it up. If there's a bloody area, I just load that up because that'll stop the bleeding as well. And so I also do this same thing. So when I deliver a case, I will, let's see. There we go. You can bite down on that, just softly. All right, give me on the clock for 5 minutes. So when I deliver a case, they will send me the prepped model because they'll have to have made the veneers on it, right? So they'll send me that. I'll just make a putty mold of that, and I'll do the same thing for 5 minutes before I deliver. It just pushes it up, gives you a little bit more room, and is hemostatic, so it's not going to bleed. It's easy. It's super easy. What? This is called Traxident. Traxodent. You can take a picture of it if you want. It's like X-Bacil is the same way. So I do. James doesn't, so you won't see it with him. But before I deliver, I will take the prepped model that they send me that I tried the veneers in on. I'll make a putty mold of that, do the same, then put Traxident and do the same thing, like right before I'm ready to deliver. And then I clean it with hydrogen peroxide, and then I clean it with Concepsis, and then we go from there. Because it's ghetto. And I don't want to save it. I mean, you could. Yeah, I guess you could. I've never thought about that, though. Yeah. So this is right before I'm ready to deliver. I've already tried them all in. I've already cleaned everything up, and it's ready to go. And so this is like the last step before that. But Dr. Heaton does it a little bit different, so you're going to see his way, too. He's super smooth. When you see him, it's like a little dance that they do, and it's just so elegant and beautiful the way they deliver veneers. It really is. I'm super jealous. So every time I deliver, I just got to think, I'm Dr. Heaton, I'm Dr. Heaton. I actually goes through my head. So, all right, where's our scanner? Are we ready? Bring that in here. Let's scan them up. We should be about good to go. Cool. So let's see. Blue Moose, Visco and Traxident. I didn't think I needed Visco, but I might. We'll see. We'll scan him, and then we'll adjust his lowers after that. Follow your cheat sheet, man. I mean, I'm serious. Have one of these. It doesn't have to be fancy. Just put it anywhere. Well, I'll probably adjust them more when after I do the temporaries, really, is when I'll probably do most of the adjusting. Yeah. Because I'll scan him again in the temporaries. Yeah.
At some point, I didn't figure out. I had the same camera as you.
Yeah.
But my little focus box is so tiny.
Oh, it's a really easy fix. Super easy fix.
Bigger area,
Yeah.
and so trying to find the right. I feel like it's
Yeah.
focuses on just a small area.
No, I'll show you. That's a quick setting. Quick setting. I know that we've had so many people buy that camera that I know it in and out. So you guys can see the retraction now. Can you guys see that? How nicely retracted that is? Like that's pretty easy to see, right? Can I get a micro brush with some peroxide? I just want to clean this area up a little bit here. Oh. It's just so finicky sometimes. Here, I'll probably use a little bit more of that. Okay. Give me some air. I just want to double check. I might have some temp material back there. Give me some floss. So I always try to floss at least the molar contacts before I take an impression too. Like that one I can't get through. So that tells me I've got something stuck in it. Okay, that side's good, but I think I've got something over here. Oh, it's a bridge. I'm like, man, there's something stuck. Well, yeah, it's porcelain. I got a lot of people watching me here. It's kind of. All right, lots of air. Can you get that white off here? Yeah, hey, I'm not, there's nothing special about me as a dentist. Zero. I don't have good hand skills. I'm not super smart. I just fooled people to come to me to get veneers. That's don't listen to Ryan, don't listen to that. Good. No, just the preps though I do, because if somebody's gonna miss him, I want it to be me. Give me a little bit air on this bridge back here, like on the buckle. Bite down a little bit. Good.
Is there a reason why you're going to change out the amount of equipment and not at prep?
Yeah, because I'm crunched for time here today. But normally I would do it right now. Yeah. Yeah. If you guys weren't here and this is a regular appointment, I would do it right now. That's the only reason. I don't want you guys to be bored out of your mind watching me do an amalgam filling. All right, let's do lowers real quick. Bite down about halfway. Yeah, honestly, my assistants are way better scanners than I am. Karam is probably also. Karam's not my real assistant. She's just playing it today. Okay, bite down all the way. See, his bite is clearly off here. Open big. Close down on your back teeth. There you go, right there. And so when patients tell you that their bite doesn't feel right after a prep or a delivery, it's because it doesn't. But it doesn't mean that it's off. He's been laying down for like 6 hours here, so. Okay, that looks good for now. You want to move that off to the side? Okay, what's my next thing? I'll adjust the lowers after we temp. Okay. What's that? Oh yeah. Prostate, go ahead. Yeah. Okay. So if you've already used this once, look at it because there might be stuff in it. And it happens all the time. Then you get voids or really, really rough temporaries. And we're not trying to do that. We're trying to get nice, smooth temps. So you can see right there. Oh, that was pretty good. I figured out the right finger. There's that stuff right there. We're going to clean that out. But make sure it gets really clean. And so where'd that toothbrush go? That's right here. We take the toothbrush and give it a scrub and give it a rinse. Cool. And then blow it dry. You don't want the air in there. This one's air only, right? Yes. Yeah, this is awesome. Just get it nice and dry. Make sure it's clean. Right. We didn't really use any Viscostat at all on him, but we did use some Traxident, so I'm still going to clean with hydrogen peroxide. And then we'll do spot etch, and then we'll use Optibond FL, and then we'll load it up. I'm going to do BL. BL looks fine. So give me another tip on the BL. What's this? Visco? All right. So this is just peroxide. Because I use a little Traxident, I just want to make sure we're good. But come and look. Can you guys see how clean this is after you use the Traxident on the tissue? Like that looks so nice, right? Like that's gonna make my temps look so good. Oh, 10, 15 minutes maybe. Spot etch. And so I just spot the dang middle of the tooth. Now where I'm not going to spot is that area that I used the composite on tooth number 8. I'll put it on the facial right here. I probably could put a little glycerin there, but I'm just not going to put any of that Optibond FL there. All right, let that sit there for about 15 minutes, 15 seconds. I woke up early today too, guys. Shut up. Then she uses this suction to take that off really good and drops the other one on the ground. That's okay. Totally good. All right, Optibond FL. Okay, and then literally, I slather this. This is kind of milky, and I put it all over the teeth. Just on the facial of 8, though.
What's this doctor applying so much? Is that correct? Like 2 different methods. Applying just for your spot etch?
Yeah, I've heard both. This is what Dr. Appa does. That's why. That's my reasoning. That's how he taught me, and that's how I'm going to do it. All right. I mean, is there a better answer? No. He does way higher volume than I'll ever think of. So, all right, you want to share this? And then just thin it. Trying to blow it away from that composite. Cool. All right. Now, I'm going to be really careful now when I do this. I'm going to start on the incisal of a lateral, and then I'm going to kind of try to be really careful that it goes to the incisals of all of these first, because I don't like patching them up, even though I know I usually have to. Okay, and we'll work the incisal all the way over. And then I overload it. because it's easier to clean up when there's a lot to clean up than when there's just a little. Good? Okay, good. All right, I'm gonna push really hard here, Ryan. I'm gonna give you a neck workout. There you go. And I'm actually putting a lot of force here because I want the lingual to be flush against the tooth, and I want everything to come out facially as much as can. And I want to have some bulk on the facial, because that will be a more accurate representation. If I'm pushing from the front, it's going to flatten everything out. Guess how I learned that one? Yeah. And see how I have marked the canines in the central here? So it's just easy. You know exactly references where you're putting that in. And then we wait. And so I'll leave this in a little bit longer than I did the first one because it was still a little soft. And I want this to lock in good. And then I also learned the hard way that I wear latex gloves. And I know some people hate latex gloves, but I like them. I feel like I can feel more with them. But they will turn these very yellow. There's just something about the latex that turns them yellow, or maybe it's the powder in it or something. And so I'm going to switch to nitrile gloves now. The temps. And I already told Ryan, this might be a little too white for him. Like these temps might be a little too white for him, and I'm okay with that because I would rather him see what he looks like with whiter teeth than wish, oh, I wish I would have gone whiter, you know? We pretty good? Yeah. So, I have no idea. Are these like extra larges? Large? I can handle larges for this. All right. The problem with this setup for me is I'm a mess. Like Jose always keeps me clean. That's why all my stuff is back there. So look at this disaster I've made over here. This is kind of, well, because I'm just, yeah. If you give me room to be messy, I'm messy. Good. Okay. Let's pick these out. There's one piece here. Okay. Now let's peel this off. Oh man, I got an edge. Give me a little hello. You're a light. Okay. There we go. Much better. Nobody saw that. Nobody saw that. It always happens. There's always an edge. I even tried really hard to not have an edge today. All right. Let's clean up. Well, let me clean up the big stuff off the lingual first. Yeah, it's just easier to clean up and see big chunks than it is little teeny chunks. I'm just doing gross cleanup here. It's not like detailed stuff yet. Okay. So I will almost always take. I just saw it. Where'd it go? This little guy. See, this little burr, I almost always will take this little burr. I'm floating, okay. This little burr and just go in at the gum line and open up these embrasures a little bit. And that's why James said, like, do that first, because that's going to cause some bleeding. And it'll be okay. And so just go in slowly. Fill that a little bit. I'm not going as fast as I could. Yes, I don't have. I mean, there is an electric here, but I'm not used to electric, so I don't use it. But all right, who's got my camera? All right. So at this point, I'm going to have a picture and just kind of evaluate it. Like, I don't think these look bad, but I don't know what they really look like because I've been upside down on them the whole time. That's too right. All right. Take a picture and look at them. Like, I think I'm a little bulky on the gingival of the lateral incisors. I'm going to take that down a little bit. I also want to make these are kind of pretty. Like, I want to make them a little tougher for him. Because he's you're tough, right? Yeah, he's tough. He doesn't want pretty teeth, he wants tough teeth. So we're going to make these a little tougher. And that's something I could have the lab do. I could have them add some manly anatomy in them because I like that. If you look at my teeth, I put a lot of anatomy in them. And so I like that style. And I think that will look really good on him. And so we'll just make these look a little bit tougher for him. But I think, again, we're a little bulky up here. And so I'm going to reduce that. What's that?
You ever do more than one case today?
Oh yeah, hopefully. Yeah, my favorite days are a case in the morning, a case in the afternoon. Or 2 in the morning, 1 in the afternoon. I don't ever like to do 2 in the afternoon. Yeah, it can be exhausting. Okay. So how do I make them look tough? Let's just talk about that. I am going to add some anatomy. You can do this with a pencil. Where's my pencil? So if you want to know where your line angles are, this is a good practice. Just turn it to the side and hold it to the side and just draw. So that's how you find your line angles. And I don't hate where those are at. Those look pretty good because they are wider teeth, but that makes them appear a little bit narrower, right? But let's say we want a little anatomy. Let's put a little bit of something like right in here. Maybe like right in there too, where the normal mamelons would be. Kind of do the same, a bigger one right there, a little one there, and then I like a nice fat one kind of right there, and a little one right there. So let's do that real quick. We'll just draw them all on here. And these don't have to be perfect because, again, these are temporaries, but it's fun. And we're the artist, and it looks awesome. And so, like, have some pride in what you do and do it. Dr. Drew Ballard, I don't know if he's still running around here. This is where he's so good. I'm kind of mid at it, but it is fun. And then I'll just take, I'm going to leave the line angles. I'm not going to push those. I actually like those. I'm just going to take this red burr here, and then you can do a football too. And then I'm just going to kind of lay it flat and then stroke coming down like that. And then I really want to get into the incisal edge on this. Open a little bigger. I love a nice aggressive canine. And then I'm going to go in with a football with the same red. If anybody sees it, tell me. That's a black one. Anybody see my red one? This one will work. And then I can just kind of go in and do this. Just follow my lines again. There, already looking more manly. I love it. Another way to do it is you can take the same skinny one right here and just kind of do the same thing. I feel like I don't have as much control with this though. And just kind of, I don't feel like my hand skills are as good with that. So I'm going to go back to this other one. And start higher than you think you should. Does anybody like notches on their teeth? Does anybody like the incisal edge notches? I do. Not as much on men. I don't like a flat incisal edge though, I'll tell you that. Then you can go in with these. This is a good one. And this, because this will remove a little bit of temp material too. Cool. All right. Now, the toothbrush is the best thing ever. Use your dang toothbrushes, guys. Yeah, I use it all the time to clean up stuff too. All right. There, that just looks more manly to me. Like, I know it's hard to tell here because we can't focus. Chin down a little bit. Yeah. Let's see it. There, they look a little bit more manly. That's not a great shot, but it looks a little bit better. Now that I'm looking, I need to push this one back just a little bit. So let's just do that real quick. There we go. Okay. You have a horseshoe? Actually, let's do some articulating here. Does everybody have hand signals for their assistants? Like, I do this all the time, or like I'll flick my thumb, or they know. All right, go ahead and tap your teeth together. Tap, 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 tap. What's that? Yeah, probably. Open. Tap, 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 tap. Open. Okay, we shouldn't have changed his occlusion at all today. Is that extra material? Is this what you're talking about? Other side, other side. Yeah, it's on the bridge. I'm actually going to take that one off, and I told him I was going to, so. That will be the first thing to break. Cool. We're pretty much in the same spots. Let me reduce a couple of spots on the inside here now. We're in my disaster. Where did my footballs go?
Oh, there's a course one there.
I don't need a course. Chin up. No, I haven't. All right. Okay, now I'm just going to adjust the lowers just a little bit. And so I'm just going to take these edges that we know are hard with a little football. Actually, I've got a bigger football in here somewhere. This one. I like this one that's slightly bigger and less pointy.
Red stripe.
Red stripe still. So not aggressive at all. And I'm mostly just rolling that corner in. Okay. What else we got? Let's glaze him and then we'll let him look.
Do that with a black disc as well.
Where's my toothbrush? What's that?
You could probably do that with a black disc as well.
Oh yeah, for sure. For sure. A black disc would work great.
In case the patient's like, oh no.
Give me some water. I don't know what's on this toothbrush.
All right, let me share something with you guys. So, did you notice he adjusted his lower teeth after he did his short scan? So you want to communicate, if you did that, the lab's still going to get a scan of those lowers because they're going to get a temporary scan tomorrow morning. When this patient comes back tomorrow for the final aesthetic check, you're going to take pictures of those temporaries and you're going to scan this mouth and send it back to lab.
Right.
You have to let the lab know, hey, I adjusted the lowers after I sent you the stroke scan.
Yeah.
Otherwise, they're not going to know to like use that model. So that's actually a critical piece of information for your lab because he probably adjusted 0.5 millimeter stuff from those that lower edge of those teeth, right? So super, super important you let your lab know.
Who was it that asked me about that? Who asked me that question? One of you guys asked me that question. I think that is.
It's honestly critical that you do that. Otherwise, your lab just doesn't know.
And typically at the end, right, after
Yeah.
you're done.
Yes, Michael, do you ever do it before?
Do what
That's
before?
ideal, right? Before your
I probably have in the past, but honestly, a lot of the times I'll do it just to looking at the temps first. But sometimes I'll think I need to, and I don't really need to.
Yeah.
But yeah, you got to let the lab know everything you do.
Yeah. I think that's probably ideal, maybe,
Yeah.
to do it that way. But having a temp in there gives you a little more information of
Yep.
exactly where, because he had a blue mark,
Let me see.
exactly where
Yep.
to change it. So whatever you're comfortable with, but if you do it this way, just make sure you give the info.
All right, everybody come and look at this before we show him. Yeah, you want to have everybody move through here? I'm going to take a picture real quick, and then we'll show him. And maybe when he stands up, these are hideous. I don't know, but I think they look nice. Bite down.
Oh my gosh. And they're only 10 Oh, that looks so good.
Open slightly. A little more. Ryan's a lady. Lock up your moms. All right. All right. If you guys want to go look at it, but you can see not bad.
Oh, yeah. They look, wow.
Looks so good.
That's why I like to add the manly anatomy. I think they were a little too feminine first, and it's not perfect anatomy, but it's something. So, yeah. Oh, here.
If this were a female, what would you have done anatomy-wise?
Probably not as much.
Well, yeah, but like
It depends on
Go
the.
through the same sequence.
Yes, same sequence, but like sometimes females just want a nice round smooth finish, and I'm okay with that on women. I just think on men it tends to be a little bit too feminine.
And the Palaceal, I feel like finishes it off.
Right, and I knew that would happen. I knew that would happen with it. All right, anybody?
It's called
Luxaglaze or Palaceal? She used Palaceal today, but I use both. I think I like Palaceal is better because it doesn't turn the colors of the temporaries different, but Luxaglaze will tone it down to her. Everybody come in, quick. Ryan is done. Ryan just wants to be done for the day. He's probably not even numb anymore. Have a quick peek. What time is it? Dang it. I was hoping to finish by 4. I'm slow. Yeah. I blame who took too much time looking. Somebody looked for too long.
Take a break halfway.
Yeah. So. I was hoping to finish by 4 and get over to the lab by 4:30. That's what it was. It's Karam. It's Karam's fault. Yeah. But you see how easy that was? Like, that was actually very easy. If I can do it, anybody can do it. And that's true. I am not any special talent by any means. Cool. Everybody have a look, and then we're going to clean them up and show him what they look like. And hopefully he likes them. So where's Karam? Not here, that's for sure. Yeah. All right. Karam, I need you. Wherever you are. Or somebody want to assist me real quick?
I'll assist.
Are you laughing? I know I'm probably a bad
No.
assistant.
No, it's fine. It's fine. It's fine. I'm just going to clean him up a little bit here, and then we'll let him have a look,
Yeah, I can.
and then we'll scan him. So I'm actually going to scan him today because I don't know what my day looks like tomorrow. And so I'm just going to scan him today just in case I can't see him tomorrow. And then we can make whatever changes we need to. All right. Here. Look at her getting dirty here. Open big. All right, we're just going to, that's not really good. All right, this is going to be super slobbery, Ryan. Okay, just be ready for it. Super slobbery.
And he came back.
All right, now let's look at them with the lip here. How do they look?
Wow.
Don't bite down hard on anything yet. All right, can you smile? Kinda. I've seen worse. So when they have a mustache, you can choose to like not have the mustache in the photo at all or have it all. Like it looks bad if you just have like a third of the mustache. We're not trying to make him look like Hitler with just a little piece. All right. Cool. Let's set him up and show him. All right, Ryan, you have to cry, okay? Yeah. You have to cry tears of joy. All right, he's going to come over to that mirror over there, so make a path for him to see. Yeah, everybody give Ryan a... That is so not easy to do in front of everybody. So have a look at yourself. Go have a look. It's going to look weird today.
Those don't even look like they look
Yeah.
like your teeth. That makes it nice.
What do we think of the color on those guys? Do we think the color's a little white or? Well, yeah. Not bad, huh? Not bad.
Not bad.
Yeah, and these are ugly compared to the finals, so don't worry about that. No, I'm serious. I'm serious. The finals look great. So cool. Everybody also give Karam a big round of applause. We couldn't do this without Karam. She is a big deal. So thank you. All right. I'm going to get him back in the chair. Karam, can you scan his upper and lower and give him all the, and try in and all that kind of stuff? You got your little retainer there. And then we're going to go all back in that front room and just debrief this real quick, and then we'll get over to the lab. So awesome. Thank you, Ryan. And then I want at least a retracted face photo. Yeah. But I do want retractors in, and then I want the full face with the retractors in. Hey, look at the teeth I just did on him.
They look good.
Doesn't he look good? I can't wait to see what he really looks like once the numbness wears off. I'm gonna try to see if we're even. We're pretty close. We're hair longer than you were before, bite down, but not like ridiculous. So I'm curious to see what you look like when you're all not numb anymore.
Yeah.
So yeah, I'm gonna turn it pretty nice. So yeah, Karen will get set up, dude.
Okay.
You're a freaking
Dude,
stud. You
thank
did,
you.
did not even move the whole
Thank you.
time. I love that. He was great. Like we almost all of the time when we're doing this, halfway through the patient needs to go to the bathroom. It's like, really? Oh my gosh, you're kidding me. So yeah, it's awesome. Some video of him talking. I know that's not gonna be totally accurate. And whether I see you or not tomorrow, I'm gonna want some pictures and videos of you, even with the cell phone will be good. But I think we're fairly close. I don't think we're too far off. So yeah, thank you.
Sweet. Okay, thank you. We'll see you. Oh, thank you. Thank you.
Oh,
Hey, take your mic off.
oh yeah.
That's what worse in my head last night. Today it was so easy to be with you guys.
Oh, yay, thank you.
So are we ready to go to the lab?
I am not typically his assistant.
Oh, yeah?
I was all over the place, but he led me so well. So hopefully.
No, you guys were a good team. I never would have guessed.
No way.
Yeah,
That's a huge compliment.
yeah, never would have guessed. And so my father-in-law, he's a traveling dentist for convalescent homes, and so I've stepped in to help wand a couple of his patients' mouths, and then I help, send it over to the lab for finish and everything. And so being in your position, I 100% sympathize. Yes.
Well, you did awesome. Thank you so much.
No.
In just a bit, I'm just gonna try this up, and then we're gonna take these scans, take pictures, create some video, and then we'll. And it goes as wide as you can. Yeah. Sorry. Close just a little bit. Move back down just a little bit again. You can see it here. She's doing so good. Oh my gosh.
She's also been sitting in this room and
Yeah, she's the best baby. Your lower lingual part fell out.
Uh-huh.
Next time you see Dr. Allen, ask him if he could just buzz away the cement you messed up with.
Oh, okay.
Yeah, be like, she really just remove the cement just in the top of the world. It takes literally 2 seconds.
Cool.
Hey,
Your tests look awesome.
Oh, thank you.
And so good. Oh my God.
Thanks.
You did such a good job. Oh my God. The natural nine, it looks awesome. Have you seen it yet?
Yeah, I did it for the first time in here.
Freaking
Jeez Louise.
awesome. Oh my God, so excited for you.
Yeah, thank you.
Cool. Yeah, I love you. Oh my God, seriously, thank you.
Let's hang out next time you come.
Yes, we'll definitely, I'll be around tomorrow too. Okay, exciting. Then you guys have the course. I might pop by. But maybe tomorrow. If you want to come with us, but we're going soon. So
Yeah.
you have that scale here, but. And Tori's going to her early anyway, so I'm just gonna go and chill.
Thank you. I love you.
Have a great weekend, everybody.
Come back down a little bit. Wait. And just say bye. She's gorgeous. Isn't she? And back down. She owns her own dental practice in New York.
Oh, no.
Huge office, yeah.
Wow.
She's kind of okay, I have to go get my camera,
Okay.
and then we're just gonna do selling some cookies.
Deal.
But hello, lady.
some pictures here.
Okay.
Have you take a seat right
All right. Is this yours?
here. Yes, yep, you're more than welcome to use it. Every time we go off, we're gonna take some pictures first and then we'll.
Sounds good.
And then just, probably just a couple pictures and then we'll go.
Oh,
through them.
okay.
And then give you a big smile.
Thank you.
Big smile.
This one there stuff up, or down row 36, let's go 25 for that. He's not smiling bad, he must be wearing off a little bit. Yeah, I mean, it's different for every patient, but. Yeah, I just wanna make sure we get the full face and the full face retracted.
Okay.
Ryan's not an ugly guy. Like, that's just facts.
Okay. Okay.
Give him the putty to take home.
Now, you know, full face.
Okay.
Okay, let's do this. Drop the f-stop down to 14.25. And open slightly?
Do you want a backdrop on that?
No.
Maybe 11.
Yeah, you were 9 or 5. Okay, even lower. Keep going, keep going, keep going. Try that. Yeah, that's fine. And this is just for lab purposes.
Sit right down all the way. And put your chin down just a bit.
Yeah, that shows me. Yeah, can you get him a soft toothbrush?
Yeah.
And his putty mold, and he should have his retainer.
Yes, you got
His
it.
putty mold's right there. I gotta head over to the lab.
Perfect.
Ryan, good to meet you for like
Okay,
an hour. and a half.
likewise. Thank you.
You did awesome.
That was awesome.
And my bag.
All right, one more,
Okay.
just full face without those.
Oh, okay, sure.
Wow, your smile is great already.
Thanks.
Look at this guy.
Man.
What? So good.
Jeez.
Celebrating that.
Just got a couple more.
Okay.
Alright, so I'm gonna retract
Yeah.
it, smile, side to side.
Quarter pound of
So
bag.
it's retracted. Perfect.
I'm clean, dude.
Where?
McDonald's, but we get the quarter pound bag, like 250. And it's like
Awesome.
And then do this.
Alright. See you tomorrow.
Okay.
And I'll talk to you tomorrow.
Okay, sounds good.
So this is your top toothbrush right here.
Oh, okay.
So that, you can use that.
Wonderful.
Give you the little putty, and then let's go ahead and fit your retainer.
Okay.
Perfect, awesome. So we'll have you wear that every night,
Okay.
every day until, basically we see you back.
Sweet.
If you know, you work on like a computer.
Yep.
And you feel like you kind of clench down a little bit,
Sure
just
do.
pop it in.
Okay.
If you go to the gym and you lift weights,
Yep.
and you feel like you clench a little bit, just
Yep.
pop it in.
Okay, awesome. We'll do it.
Put that in there. There you go. I'm gonna give you a little list, and this is like our guide to just eating soft foods. You just have to be on a super soft food diet.
Okay.
So these are the things we recommend, but some of the hardest things we hear from, just generally it's just the soft foods, right? So like everything else is pretty easy.
Oh, okay, great.
So just recommend scrambled eggs, mac and cubes, like kind of all that stuff. Make sure you stay drinking like protein shakes, that's how you know it.
Okay. Okay.
There you go.
Awesome.
Do you have any questions for me?
Good to know that they can stain, so I will be sure to use
Yeah,
straw.
try to stay away from curries and stuff
Okay.
like that.
Okay. Wonderful. All right. Well, thank you for
You're
everything.
so good.
Really
Thank you
appreciate
so,
it.
so much.
Thank you. You guys made it really easy to sit there.
Yeah, I'm so glad you had a good experience.
Absolutely.
Do you right here, or you got it?
I have a friend, yeah, he's
Okay.
just getting off work, and so he's just gonna take me back to his place.
Okay, perfect. What? Where's everyone at? What happened? What was that? Yeah. It's right on. You said that you should be.
Okay, then yeah, plan on it. Are you good with that? Yep. Okay, all right. I was gonna hang out until. No, go left.
Yeah. Okay.
Hey, is Kurt's case here? What? Is the case we're seating tomorrow here?
I don't know. Did it? That's Tucker Demore.
What is this? Take to class this weekend. Oh, this is something my parents.
Doc, you're making me nervous. Let me see.
see.
Should be
Oh,
on.
they read Chase's case record?
Yeah, it's in there. It's in one of those. It doesn't say veneers in. like on his appointment book. And usually I trust Sydney pretty well.
So he doesn't work Fridays.
Oh. You know what?
Was Savannah here today?
Savannah was here, yes.
Did my case get delivered that I am speeding tomorrow, question mark?
Oh, okay. Doc, this is my Jade weekend, and I can't leave her at school too long. It's just summer school.
Okay.
Do you mind if I just kind of just clean up and then,
Show tomorrow?
yeah,
Yes.
we're gonna learn tomorrow. And the court's gonna be here tomorrow? Right now.
What's that?
Court's gonna be here tomorrow?
Yeah. Oh, so you're coming at all tomorrow?
I was gonna go to the thing and you guys needed some help, because I know Sierra's not going.
She's coming here for like an hour or two.
Okay.
Yeah, I would come to the hotel for sure.
Okay.
And then maybe just come initially to make sure things are running smoothly here.
Yeah, I was thinking like with everything with that, so it doesn't happen again. I think it's the Wi-Fi. Or something is, because this keeps like buffering.
Yeah, I know. Gosh, dang it.
What's wrong, bro?
I'm just really annoyed that like the most important thing for me this weekend was just stuffed under Sydney's desk. Catfish. Not checked in, not anything. Now just stuffed under desk. Like what the actual fuck? You know what I mean? Like
I agree.
there should have been crazy communication between Sydney and Savannah. Like, hey, Dr. Heap really needs that case this weekend. Please let me know when it comes in. Text us both.
Absolutely. I agree. I mean, it's only like a $20 course of the year. Because, you know, I wouldn't know where it's at, you know what I mean?
That case is unbelievably important to us. Yeah, 35 doctors expecting to see that case get sealed. Are you gonna come here first thing and finish this up before you go over there, or what's your plan?
Yeah, I could do that. Honestly, that would probably be better, so I can leave right now.
Yeah, and I'll just have Chad stand for you. Make sure this door is locked.
And the other one.
Get everything up.
Bye.